All right, so let's get started. I would first like to welcome everyone to the Justice and Equity in Perinatal Services seminar series. Before we go forward, I'd like to start with a land acknowledgement, and I encourage everyone who's joined to introduce themselves and also share the land that they are currently residing in. So my name is Tamar Austin, and I would like to humbly and respectfully acknowledge the land on which I and the Birthplace Lab currently reside is the unceded, stolen traditional territory of the Coast Salish peoples, including the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm especially grateful to be a guest on this land as someone whose family originally immigrated from the Caribbean, my ancestors having been displaced there after they were stolen from their own lands. As we gather here today, we honor and recognize the importance of sovereign birth and traditional birthing practices of the peoples whose land we currently reside on. We commit to make space for and support the holders of traditional birthing knowledge who have remained steadfast in their practice despite the best efforts of colonialism and white supremacy. It's our obligation to continue to be proponents of reproductive and birth justice, especially in the face of deeply entrenched inequities. So I would like to welcome everyone to today's seminar series, and I would especially like to welcome and introduce today's speaker, Dr. Mahadeo Sukhai. So Dr. Sukhai is the world's first congenitally blind geneticist and currently the Vice President of Research and International Affairs and Chief Accessibility Officer for the CNIB, the Canadian National Institute for the Blind, having previously served as a researcher at the University Health Network in Toronto. Dr. Sukhai is a leading expert on accessibility of graduate and postdoctoral research training in science, technology, engineering, mathematics, and healthcare disciplines. Dr. Sukhai is also the chair of the Employment Technical Committee for Accessibility Standards Canada, as well as the external co-chair of the Canadian Institutes of Health Research Expert Advisory Committee on Accessibility and Systematic Ableism. Today, Dr. Sukhai will focus on his work establishing a national framework for the accessibility and inclusivity of research methods and practices within academic and community research settings. So without further ado, I'd like to pass it on to Dr. Sukhai.
Thank you very much, Tamer, and good morning, good afternoon, everyone. It's a real pleasure to be here with this group today and to share some of the ongoing work that my team at CNIB Research is undertaking. Before I formally start the presentation, I too am a first-generation immigrant to these lands, also from the Caribbean, and uninvited guest on what is now Kingston, Ontario, the traditional territory of the Haudenosaunee, Anishinaabe, and Huron-Wendat peoples. I'm privileged to be able to live and work and play on these lands. So I'm going to talk to you today about responsible conduct of research through an accessibility and inclusion lens. I'm going to start by sharing my screen, and then hopefully we'll all be able to interact with the presentation. Screen. Hang on 1 second. Thought I had this thing set up for a PowerPoint presentation. I must have stopped that. Okay, there we go. All right, let's try that again. Okay, so I'm going to share my screen with everybody. I'm for my own ability to actually control what's going on for myself, I'm going to minimize my video feeds. And so my interaction with you is voice only at this stage. I don't have the chat open. I don't have video feeds. I'm not registering hands. I'm going to chat with you for, I'd say, about 35 minutes or so. And hopefully we'll have 15 minutes for a conversation and discussion. First of all, I'm going to start by acknowledging the team that's actually doing this work. I'm really, really blessed to have a very, very strong research team at CNIB, um, made up of many diverse individuals. I actually did a head count at one point, and I don't think I have a single straight, white, able-bodied, heterosexual male on the team. Um, Everybody identifies with at least um, one intersecting social identity. 80% of the team or 85% of the team is persons with disabilities. And we've got a lot of diversity of lived experience within the group. Andy Livingston is the overall project manager for this project. Ainsley Latour and Anna Sophia Barrows have led a number of significant pieces of work related to what I'm going to tell you about. And Michaela Knott, Asin Zaman, Ola Olatona, Naveen Benjamin, Simran Kalon have all worked on various pieces of this project. Jacqueline Levine, like myself, is a fellow member of the executive at CNIB, and because of part of the project being relevant to privacy frameworks and consent language, she actually co-supervised part of the work as well. Um, and so our funders for this project come from a couple of places. The Office of the Privacy Commissioner of Canada funded the work that I'm going to talk to you about that focuses on idea and consent. And Accessibility Standards Canada's Advancing Accessibility Standards Research Program funded the core project itself. I'm going to tell you a little bit about CNIB research because I think it's important for you to know who we are and what we do. Our vision is to become an international center of excellence for person-centered and systems-focused accessibility research, an engine for capacity building within the accessibility research community, and a world-class leader in knowledge sharing about the quality of life and lived experience of persons who are blind, deafblind, and low vision and visually impaired around the world. Our specific objectives within CNIB research are: one, to collaborate with the global research community in understanding the intersection between blindness on social determinants of health through an intersectional accessibility lens, to develop a longitudinal understanding of the impact of rehabilitation and programmatic interventions on social determinants of health for persons who are blind, deafblind, low vision, visually impaired. Three, to carry out systems-level research to understand and propose solutions to prevent and/or remove barriers to participation in society that are experienced by persons who are blind, deafblind, low vision, or visually impaired. To build systems capacity within the research community for the inclusion of researchers with disabilities and the performance of research according to accessible and inclusive best practices or standards. You'll hear a lot about that in today's presentation. To ultimately compile and curate a global encyclopedia of blindness and to educate relevant stakeholders about key findings arising from our research endeavors. So those are our objectives that we've set for ourselves as a team. And give you a little bit of context as to who we are and what we do. CNIB Research in its current form has existed for the past 6 years and 3 months and some days. Currently comprises about 19 staff and research consultants, and we take about 50 students a year who do various pieces of work for us. We are a knowledge generation shop. We actually, I would say, a knowledge generation engine, and through presentations and conversations like this, we're also a knowledge translation engine. So let's talk a little bit about barriers experienced by persons with disabilities in research. Let's start with a bit of an overview about disability in Canada, and this is from the Canadian Survey on Disability 2017. The 2022 numbers are available, and I'll highlight some of them as we go along. So in 2017, approximately 6.2 million individuals, 22% of the Canadian population aged 15 and over, lived with one or more disabilities. As of 2022, that number is 8 million and 27%. The prevalence of disability increased with age, ranging from 13% in 2017 for those aged 15 to 24 to 47% for those aged 75 and older. That 13% has gone up to about 20%, and the 47% has gone up to about 50%. Women were more likely to have a disability compared to men. It's 30% today compared to 26%, whereas before it was 24 and 20. And then as of June 2023, Canada's population hit 40 million Canadians. So as Canada's population increases, you would expect the number of persons with disabilities to increase. But an interesting thing happened between 2017 and 2022, and that thing was called COVID-19. And one of the societal consequences of the pandemic is our and perhaps not just the pandemic, but certainly a lot of this has to do with the pandemic. There has been an increased willingness on the part of persons generally to self-identify as living with disabilities. The CSD is a self-identification questionnaire. And yes, it's based on the Washington Group the Washington Group long form set of questions, but it's really based on persons with disabilities self-identifying. It's not based upon any medical diagnosis. And so as a result, if people are self-identifying more than they were in 2017, then we need to talk and think about reasons for that. And one of them certainly is the COVID-19 pandemic. As the number of persons with disabilities continues to go up, however, what we continue to see, what we continue to experience are barriers to engagement in research. For example, we find limited representation and diversity in research samples, which will lead to biased results and limited generalizability of the data that are collected from persons, exclusion of valuable perspectives and insights from individuals with disabilities, which will result in research that does not fully address needs and experiences, inadequate accessibility measures in research protocols, materials, and data collection methods, preventing full participation of individuals with disabilities. We will find lack of consideration for accommodations and assistive technologies and accessibility supports generally, which will hinder individuals with disabilities from fully engaging in the research process. And we will find failure to address the specific challenges and barriers faced by individuals with disabilities, resulting in research findings that do not adequately inform inclusive policies and practices. I could take a whole hour by itself to take you through case studies behind all of these. Suffice it to say that these are not just anecdotal experiences. They're anecdotal with weight because of the sheer volume of them. So we take as a given in today's world, my team certainly does, and I invite you to join me in this, that the way that research is conducted is not accessible or inclusive to persons with lived experience with disabilities, whether you are a research participant, a member of a research advisory committee, or a core part of the research team yourself. And so when we think about disability in research, then we really have to consider how we conduct human-centered research. And it's crucial in that context to take into account this population of persons with disabilities. This will ensure inclusion and inclusivity and will promote equal participation and equitable participation in research studies. And considering the prevalence of disability in Canada, it becomes even more imperative for us to prioritize accessibility and inclusivity in research methods and practices. The question then becomes, well, how do we do that? And the core driver behind the project that we have funded from Accessibility Standards Canada is in the context of human-centered accessibility research to evolve a series of recommendations around ensuring that we are conducting research in accessible, inclusive, and respectful ways, that we are conducting responsible conduct of research through an accessible and inclusive lens. So let's talk about how we actually set this up. Our research goals for this project were to develop a framework for accessibility and inclusion in research with persons with disabilities in Canada, to identify and eliminate barriers related to researcher attitudes towards persons with disabilities and disability inclusion in research, to address barriers throughout the research process, including research priorities, recruitment practices, consent practices, data collection strategies, analytic tools, evaluation processes, and knowledge dissemination, to propose solutions based on best and innovative practices to prevent and remove these barriers, to highlight best practices and program innovations for researchers with disabilities in their chosen field or academic discipline. What's illustrated on the slide right now is a bit of a cartoon showing the research process. And arguably it's cyclical, but the research process starts with a preliminary exploration, the defining of a research question, or research questions plural, the performance of a literature review, the identification of research resources needed to conduct your study, the establishment of methodology and design by defining the methods that we are going to use to collect data, building out a research proposal, and undertaking an institutional ethics review. The research process itself involves the performance of experiments, the collection of data, and the analysis of data. And experiments here are broadly defined, and really sort of refer to the engagement of persons with disabilities or persons without disabilities in research directly. Finally, we get to sharing of results. And so here we talk about writing the research reports, publishing the research reports, going through the peer review process, sharing the results at conferences and other venues. We undertook a pretty comprehensive methodology to do this work, and a number of the pieces are actually still in action as we go along. So we are conducting an international environmental scan and literature review to identify practices, policies, and approaches, relevance to defining accessibility and inclusion principles in different research fields. We're conducting survey and focus groups with persons with disabilities and their peers to identify barriers and best practices for accessibility and inclusion in research. We are establishing an international panel of researchers with and without disabilities to curate best and innovative practices for accessible and inclusive research using a combined Delphi method and co-design approach. And we are integrating the gathered data to develop approaches for preventing and removing identified barriers for iterative evaluation through co-design methodology. From this work, we expect to develop guidelines and principles for consulting persons with disabilities in accessible and inclusive ways in research. We expect to develop equitable and inclusive mechanisms to an understanding of informed consent and processes informed by universal design principles. We expect to identify and develop accessible and inclusive research design and methods via international consensus. We expect to identify a disability inclusive data analysis techniques, instruments, software, and applications, and we expect to identify accessible and inclusive data ownership strategies and knowledge sharing activities and practices. Pretty ambitious. There's actually 4 vignettes that we will take you through, not 3. I didn't update the slide as the last vignette got added in. I'll talk with you briefly around the work we've done on IDEA and consent, talk with you about the accessibility of survey platforms, talk with you about accessibility and research ethics, and also share with you the results of our policy scan of research policies from post-secondary institutions and research institutes. So let's do vignette number 1, IDEA in consent. This was a project that actually started in mid-September of 2022 and completed at the end of March of last year. And the focus was on the intersectionality of privacy and consent with IDEA principles. IDEA, in this case, inclusion, diversity, equity, and accessibility. We had a practical focus here on improving methods of obtaining consent and protecting privacy for persons with disabilities, particularly those with sight loss. The objectives of this project were to conduct a literature review on consent and privacy through the lens of intersecting identities, to conduct stakeholder meetings and focus groups with experts in privacy and consent, to conduct consultations with community groups representing different identities, geographies, and abilities, to conduct focus groups with CNIB clients who were blind or partially sighted in Canada, to synthesize the research findings from Delphi method co-design and lit review, to create recommendations for implementation and dissemination to privacy professionals and stakeholders, and ultimately to develop a framework for integration of IDEA principles within CNIB's risk management framework, and also to revamp our research consent practices. When we did the lit review, we did this with a focus on consent and privacy through intersecting identities, and identified a number of themes in the literature review: capacity, self-determination, legal and health literacy, cybersecurity, and risk. We use this to think through conceptualized templates for privacy protection and consent documents. There's actually very sparse literature on the focal point of the search, but many intersecting materials from other relevant research areas. These identified a need to move away from a health-centric view of privacy and a focus on accessibility support within the private sphere. There were limited resources that we identified for individuals with disabilities to protect privacy and rights, which led to challenges of facilitating informed consent while complying with ethical board requirements. We also undertook a review of legislation and case law to provide a framework for this research. We identified 11 themes from the key findings of this project. The first one of those being safety. there were concerns related to safety when disclosing information for consent, particularly in terms of vulnerability of individuals with sight loss due to inability to verify being watched or taped. The use of cameras to enhance security and provide a record of interactions was one of the reasons behind this, and a heightened concern with safety as something that individuals with disabilities live with daily. The second theme was authentication and verification. There was, from the perspective of persons with disabilities, an inability to authenticate or verify information in preferred methods of communication. There was a challenge for individuals with sight loss in particular to verify information provided to them, and a limited accessible documentation for individuals to independently verify. The theme 3 was multi-method approach. There needed to be a multi-method approach to obtaining and verifying consent. Written consent using signature, was by itself insufficient because signature as a method is actually not accessible. Providing information in multiple formats to accommodate diverse consumption, and concerns about electronic methods of consent not being verified or being misused. The fourth theme was education. The importance of empowering individuals with disabilities about their rights. There being a need for disability sensitivity training for service providers, for education on accessible documentation requirements and production for managements of organizations seeking consent, and a need for improved education and information dissemination on consent, privacy, and human and rights. Theme 5 was plain language. There being a need to develop plain language documentation that met both the legal requirements and also the requirements for persons with disabilities to understand. Balancing comprehension and legal responsibility in consent forums is tricky at best. Today, it skews much more toward legal responsibility than comprehension. But that balance was something that we identified needing to be redefined. There being challenges of understanding consent forms without the chance to review, and individuals with disabilities or chronic illnesses could have different levels of capacity on a daily basis, depending on the episodic nature of their conditions. The sixth theme was accessibility, and focusing here on documents in the built environments. Enhancing accessibility in documents in built environments would enhance self-determination. Authentication and verification were identified as challenges, particularly for individuals, again, with sight loss who struggle to independently verify information. Education was highlighted as crucial, including empowering individuals with disabilities about their rights, disability sensitivity training for service providers, and educating management on accessible documentation requirements. Theme 7 was personal impacts, something that we subtitled pressure. Again, safety concerns were highlighted, including issues of vulnerability, privacy compromise, and the need for personal responsibility. Again, the importance of a multi-method approach to obtaining and verifying consent was emphasized, with the need for information to be provided in multiple formats. And participants here expressed a sense of pressure to quickly consent and not be a burden, impacting their interactions and decisions in various aspects of their lives. The eighth theme was self-determination. Participants here expressed a desire for greater independence, including the ability to travel on short notice, schedule appointments on their own, make decisions independently, attend appointments without parental accompaniment if they were minors, and regain their privacy and sense of individuality. Participants also expressed concern over self-service kiosks that lacked accessibility in the context of this work. Proactive versus reactive approaches was the ninth theme that we identified. Participants here spoke of the need to be proactive with options for acquiring consent, requiring service provider representatives to be proactively available to individuals who required accessibility supports to a service point of entry, and a universally designed approach to documentation and consent was needed so that the materials that were used were accessible for all, rather than just meeting the needs of one group during an interaction. Isolation was the 10th theme. Individuals here spoke about being unable to interact with many of their peers in the community due to a lack of awareness and understanding, and that more needed to be done to make services more welcoming, and the need to get away from services being provided in silos, and the need for a holistic approach to service provision and by extension, consent. The last theme was creativity. There being a need for more creativity in how information was shared and how consent is acquired or given. there's also a need for urgent information between departments of organizations, a need for sharing information between the departments of organizations so that the constant need to reaffirm the information is not required. So the notion that in consent practices, we will often reconsent and re-verify to make sure, and while there's a legitimate sort of research ethics need to do that, it does come across to persons with disabilities as redundant and potentially not a great use of their time and not a great use of their ability to access the information. Moving away from the idea and consent piece, I'm going to talk for a little bit about the second vignette, which is the accessibility of survey platforms. We undertook testing of 10 commercially available accessible survey platforms for their accessibility. Our testers were members of our research team and had a variety of lived experience with research and accessibility. All testers were blind or low vision. Tests were done with the most up-to-date technology at the time of testing, and none of the people involved had any conflict of interest in the evaluation. We developed scoring criteria across 25, we identified 25 scoring criteria across a number of different categories. We looked at front-end and back-end accessibility, screen reader and screen magnifier compatibility, customization of color schemes, font, contrasts, and sizes, text sizes, English-French compatibility, compatibility with multiple browsers and operating systems, including VoiceOver, survey design and analytics features, and Canadian privacy law compliance. The scoring criteria were actually set up so that you could actually have a negative score. If you were not compliant with something, we penalized you. If we couldn't evaluate your compliance, you got a score of 0. And if you were compliant with something, you got a positive score. So your maximum score was out of 25, your minimum score was -25. And the graph that is on the slide actually illustrates the scores of these 10 platforms. The lowest scoring platform actually scored -16, which again was pretty poor because the lowest possible score was -25. The next two scored -13 apiece. The next one scored -4.5, and then there were 6 platforms that scored on the positive side. One scored +8, one scored +8.5, one scored +10.5, one scored +12, one scored +14.5, and then the last one scored +21.5, and again the maximum score was 25. The one that did best was Qualtrics. The one that did worst was a survey platform called Typeform. There's some common survey platforms here. Lime Surveys, for example, is pretty common. Survey Gizmo is pretty common. Survey Monkey is pretty common. A lot of people love to use Google Forms or Microsoft Forms. At the time that this was done, Microsoft Forms scored really badly. Microsoft Forms today would actually score better because the platform has been upgraded a fair bit since this work was originally done, but I don't think it would actually score anywhere near as Qualtrics. It might score about as well as Google Forms or SurveyMonkey would. And so what this gives you a sense of is there's this massive range between the very best and the very worst within the systems that we tested for accessibility. There was no clearly fully accessible survey platform. All platforms were missing or hadn't thought about some significant pieces of functionality. And the types of issues that we identified really came down to 3 different broad categories: platform issues, configuration issues, and survey design issues. Platform issues were really the biggest areas where many survey platforms did poorly. These issues were particularly concerning for us because without a vendor working to improve accessibility, we actually had no ability to really do anything, or no one actually has any ability to do anything to fix these errors. The most common challenges that we had, so questions were not correctly semantically labeled, custom elements were not correctly marked up with ARIA for screen readers to interact with, very poor support for VoiceOver, color contrast and font were not sufficiently configurable, checkboxes and radio button functionalities were not correct for screen readers, no survey platform, almost no survey platform, not no survey platform, almost no survey platform had an accessible backend, and few platforms really offered Canadian data storage. There were also a number of configuration issues. Some of the survey platforms offered options to improve survey accessibility, but it was challenging as it really relied on users knowing that they needed to make these changes. So for example, there were accessibility specific options in some platforms, some custom themes, fonts, and formatting. There were some features that were available, such as the ability to insert page breaks, the use of built-in automated accessibility checkers, and then various options such as SurveyMonkey's classic versus one question at a time views. But again, you really needed to understand how each of these kinds of things interacted with accessibility on the front and back end in order for you to make intelligent choices about what you were doing. User design issues was really the last category of issue. And here, many problems, no matter how accessible a survey platform is, actually stem from how the user designs a survey itself. These are not related to any platform. They are correctable if somebody knows what they're doing. And so, for example, we tend to warn people away from matrix questions. We tend to encourage people to break up long surveys into pages of 5 or 6 questions per page. We recommend using correct question types, such as checkboxes for multi-select and radio buttons for single select. It seems very intuitive, but somebody who doesn't know what they're doing can cause a lot of challenge if they're using the wrong question type for the question. Questions in plain language, so that there is no doubt about what type of data someone should enter. One doesn't ask a yes/no question and then provide a text box, for example. And then the issue of question requirement and prefer not to say options was also part of the user design features that we were identifying. So what I'm hopeful that you're getting the sense of at this point in time is that the current lay of the land is that there are major challenges with consent. There's major challenges with surveys as a data collection tool. I'm going to talk to you about the audit that we did of post-secondary review ethics forums. We assessed 15 universities, 7 colleges, and 1 community ethics board research ethics website and research ethics board application form across Canada. We focused on the accessibility of the research ethics applications for researchers with disabilities. We checked if participants with disabilities were considered in the design of these processes. We audited resources for human research ethics boards only, not the research ethics board materials that didn't involve human participants. Even the terminology human subject participants is usually the terminology that's used. Here's what we found. From a platform perspective, most forms allowed keyboard input, but it was unclear if they could be submitted without a mouse. So there was some keyboard functionality, but it wasn't completely keyboard navigable. So that's one accessibility issue that we identified in reviewing research ethics web forms. There was no accessibility support provided for researchers in any platform. Some forms had illegible text due to small font sizes and poor line spacing, and this was not something that could be modified within browsers. 2 websites were not navigable at all by the keyboard. 8 had small font sizes affecting readability. Image captions and text descriptions were missing on all websites. 10 institutions lacked an inclusive research statement. 4 provided a general statement without referencing research specifically. Some websites did not include information about ethics committee memberships and meeting dates, so it was unclear when you needed to do work and how work needed to get submitted. 8 websites had accessibility statements. 5 had separate accessibility pages. 10 had no statement on accessibility whatsoever. 2 institutions had video instructions for completing ethics applications, while 5 had no video or non-video help. Relevant to the research ethics application themselves, only a few institutions explicitly asked about including participants with disabilities in their studies. None of the audited ethics forms required researchers to demonstrate their commitments to accessibility and disability inclusion. Only a small number of ethics forums addressed research conduct in a culturally sensitive manner. A dissemination of study outcomes to participants and equity groups was not addressed in most ethics forums. Several institutions had policies or information on risks and protections, but only a few had specific policies against abuse. Only a few institutions had visible information or policies on research involving Indigenous communities. Compensation policies of institutions did not mention persons with disabilities or accessibility supports. Some institutions offered resources for researchers working with Indigenous communities, but that's about as far as they went. Again, from the perspective of inclusion of persons with disabilities in the research ethics process, not there, right? There's a lot of work, I think, that we still need to do within that space. I would also say there's a number of institutions that we certainly like to look at. We're constantly adding to that list, and so if there's anybody here who wants to help us do a review of your research ethics space, we have an audit tool, and we're happy to share it with you and walk you through what we need done, or take you through what we need done. The last vignette that I would share with you very briefly before I wrap up and take a conversation is preliminary findings from our Research Institute policy scan. Here, what we've done is gathered policy information and tools from multiple institutions, community and academic resources. So approximately 48 institutions we've screened. We've completed an organizational review of academic institutions, independent research institutes, and research hospitals to get an idea of structure and content for the purpose of our policy work. We've reviewed language used in policies with an accessibility and inclusion lens, completed a literature review of policy construction and best practices, reviewed best practices using, again, an accessibility and inclusion lens, and developed a concept map of those best practices. Some of our key findings: institutional policies are inherently rigid. We identified here that more could be done to include accessibility and inclusion in documents in the research policy space for institutions. There was a lack of inclusivity and understanding of disability, especially when referencing persons with disabilities within these policies. Document access and in-document accessibility were also barriers, challenging to access while also difficult to navigate through. We also found a bit of an ableist lens in the policy write-ups that we've reviewed so far. Community organization policies appear to use less legal language, meaning that they seem to allow potentially for less rigidity and may allow for more flexible or accessible work environments. So policy scan, accessible surveys, research ethics, consent. We've identified significant accessibility barriers in all spaces for persons with disabilities in their participation in the research enterprise and in the work that we do in human-centered research. Having identified those barriers, we continue to do work on things like compensation, other parts of the research pipeline and research process, data analysis tools, knowledge mobilization, question generation, and so on. And so as we move through this space, I'll tell you what I think is going to happen. What I think is going to happen is we're going to continue to identify a number of accessibility barriers throughout the process. And if we were to map barriers onto the process that I started with at the very beginning, we would find barriers everywhere. For some of us, this may not be surprising. For others of us, it might be surprising, but for all of us, it should be disheartening. And so the next step in this process for us as we move our way through is then to ideate what would a truly accessible and inclusive research process look like? What would that experience be like for researchers with disabilities, members of advisory groups, members of research participation cohorts? The next time I chat with you about this, I hope to actually share what those findings are and ideate with you what the recommendation should be, and co-create with the community what I think would be a really powerful tool, which is how to do accessible and inclusive and respectful human-centered research. So our next steps in all of this, we have a scoping review that's underway. Our Delphi method approach is also underway. We're completing the policy review, and we've got some co-design sessions that are planned. As we've done this work, working with some other collaborators, we've actually spun off two other conversations, one being accessibility and inclusion in research related to healthcare innovation specifically, and one being accessibility and inclusion in research related to artificial intelligence specifically. So more on that as time goes on. My email address is on the last slide. It's simply my name, first name dot last name, Mahadeo.Sukhai at cnib.ca, for any of you who wish to reach out. Otherwise, I would say Tamer and Tia and Saraswati absolutely know where to find me. And so if anybody wants to be in touch, please, by all means, feel free to reach out.